Hey, this is Renew Education. This is a case study. I call this one the dry mouth disaster. This is one of the worst scenarios that I've fallen into with dry mouth cases. And it's a disaster because it kind of fooled me based on the patient's information. Not that the medications and things weren't apparent, but it was more about the discussions we had with the patient, or I had initially with the patient, starting a few years ago, at least now, maybe it's been 4 years. We're still working on this case. And what it was is that he is taking antidepressives and such that are pretty severely causing dry mouth and rotting his teeth away. I have recently seen last year, a year before, on 2 cases of young adults, 2 particular female adults that didn't like to hear what I had to say about their problem and their medications, their dry mouth medications, or the medications that are causing dry mouth were these antidepressives that they were receiving to deal with their issues. And basically they were looking maybe not as bad as this case, but very similarly. And they were in their early 20s, and so the reality check wasn't a reality check that matched their reality. This guy had told me that he was getting off his medications and that things were so much better and all these things. Well, he never got off his medications. He's still not off his medications, and he's still thinking that, and I think that's the psychology of this type of patient. Beware of the antidepressive crowd, I would say. The heart, dry mouth causing heart medications, those patients aren't dealing with the psychological issue as much as a physical one. So my warning here is to really re-examine what's going on with people that are taking some high doses of antidepressant type of medication that can cause severe dry mouth, and you see signs of severe dry mouth. Here in this case here, just quickly looking, you can see rampant decay all through a lot of these lower teeth here, as well as throughout these teeth here. And you haven't even looked at it from a point of view from standard little x-rays that are going to show you more high definition. So a lot of these teeth, initially we were hoping to save, and so there was a point in which, hey, he's got all these teeth, can we just do quadrant dentistry to try to clean up these teeth and do the more tooth by tooth or quadrant type of dentistry that you're trained to do as a general dentist. But this turned into a disaster because all the dentistry we did got recurrent decay, and all has kind of failed us, and he's into 4 implant locators, but he's on so many different meds now at this stage from 4 years ago that his bone healing may be a problem at this stage. So it's a secondary problem now due to more medications. So maybe it's just say more medications, not good or something is the name, but let's stick with dry mouth disaster. Anyway, let's look at the treatment assessment here. I just have the bone quality is pretty good, so I give a light green on the bone density, yellow constriction, orange sinus, but here's where the red comes in. The red comes in under patient medications. In particular, you're going to write that down in what they're taking. I'm not going to talk about that so much. In a different video, we talk about dry mouth and dry mouth medications. So let's just quickly scroll through. I'm not going to go through the details, but I brought this case up because what I want to do is do follow-up videos on this case, and you can see how it just keeps going down this black hole as we're trying desperately to try to keep his native teeth intact. So here we go. If we look at our sinus area here, we want to see decent quality bone here. We have decent quality bone here, and we see the roots going into the sinus a little bit. So that's not great. That's obviously now becomes more of a challenge for everybody. There's some curved roots, so it's more of a challenge extraction. But this is about, if you lost this tooth, this is what you could expect. If you graft it, you're looking at maybe about 7 millimeters to the sinus. So this would be a sinus bump type of case when you have to put an implant into that molar area here. As we scroll along into premolars here, we're still at the floor of the sinus, but it looks like we have a lot more bone from here to here. So that's not too bad. Tricky little roots there. You're going to come into this. Also, he has split roots again. And then we have a root canal that has a fenestration going on right at the apical end. So these are all kind of grafting type of cases. When you extract these teeth, try to maintain the bone. Here he is, that yellow, the constriction coming across here or here. So that's not so great once you extract that tooth out. I have as a yellow constriction. The reason why I have yellow is because this is actually still fairly wide. We've got almost 7 millimeters here to work with, so that we can work with that. And then down here, it's not terribly wide either, but it's still 6 millimeters. Better than most. Better than most. So maybe it should be an orange, but I'll give them the benefit of the doubt. I'm going to give them yellow, even after it's been a total disaster on other fronts. And here we go. We're going to just see more of the same, more of the same, more of the same. So it looks pretty good. And if we get back here to this molar here, and now you can see how much those roots actually are going into that sinus area. So pretty much your first molar issues will be present. Things will take time if you get into this case. This isn't the biggest deal when you're just dealing with a normal situation in terms of general dentistry. Maybe you extract this or do a root canal. This doesn't look like that one. That one looks hopeless, but if you clean that one up and clean this up, maybe you do some sort of bridge. Maybe you do a bridge from here to here. You know, there's some restorative elements that you could do here. Maybe you do an implant here. Maybe you do some sort of crown here. There's ways to fix this case for sure. Let's look at some of the lower qualities. We've got decent bone here. If we lost this one, you know, our nerve is in a good position. We have good solid facial bone. We have some nice medullary bone. So overall, this is that kind of case that you don't realize is going to go downhill until it's kind of sailing downhill already. Here the facial plate doesn't look great. Maybe it's just my CT, the way I'm lining it up, where it looks very thin. We're going to look at the 29 tooth. That gives us a good idea about where the nerve is too. You know, you always can expect the nerve to be south of the apical part of the root. So here you can see the opening of the foramen of the nerve here showing up. So we know the nerve is down here. So we've got a lot of bone on the outside. So that shouldn't be a full arch case, but it ultimately does. And the patient just kind of has to get real about, or maybe it's a physician thing. You know, this case is just one of those cases that came around. I have not fallen into a case, this severe dry mouth case in a younger person. He's in his 40s, that is dealing with a lot of his own issues and has a lot of dental issues, obviously, now. So, yeah, let's follow this case later on and stay tuned for that one. Okay, great. Anyway, like us on our Facebook channel if you like. If you can, subscribe to us on our YouTube to stay in touch with some more case studies that we're doing. And we'll talk more about this case in the future. Thanks.